Good morning and welcome to Ask Dr. Murphy, This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
Good morning. Trying to stay cool.
Absolutely. And we hope everyone is looking forward to the holiday weekend. But Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines through today, July 3rd, and we welcome any questions or comments down below or at any of our social media linked in the description. Starting today with an analysis on the mRNA COVID vaccine versus the protein-based shot. Can you tell us about it?
Yeah, so we know that the approved vaccines for COVID include the Pfizer and Moderna vaccines, which are mRNA technology, the newer technology, and Novavax, which is based on the older technology that most other vaccines are based on. And those are called protein-based. So the difference is the older approach is a little bit more cumbersome and takes more time to actually develop it. The mRNA, much more nimble. You can change things at the last minute. Anyhow, the study, large retrospective matched cohort study, analyzed over 103,000 insured U.S. individuals, and they compared people that took the mRNA vaccine or the Novavax vaccine. First of all, both are better than no vaccine. So if you don't want to take an mRNA vaccine, you don't have to. You can take the Novavax one and it works okay. But the mRNA vaccine works 31.7% better. And so this relates to medically attended COVID-19. So, ending up in the ER or the hospital or something like that. Probably that reason, or at least in part, was that the Novavax vaccine was able to switch the targets at the last minute and target a more relevant strain of COVID compared to the Novavax one, because they were unable to change that when the new variant came out. But regardless, they both work. Both types of vaccines work, but the mRNAs look like they do better.
And that was part of the breakthrough with this mRNA vaccine technology, that you can switch these things up so quickly. It's really remarkable.
Right.
Now, another COVID and flu related story this time about those vaccines. Are those two shots safe to get together on the same day?
Yeah, we've been talking about this for a while. When you want to vaccinate people against both diseases, COVID and flu, which every respiratory season, starting in September, really with when the vaccines come up, you want to be given both of these shots. Now, if you give them one at a time, what happens is, from a public health standpoint, and millions of people taking them, a whole bunch of people drop out because they just don't make it back for the second shot. It's cumbersome, or they miss it, or they put it off and never take it. So giving them at the same time is the best from a public health standpoint. Now people are saying, well, if I take both, I'll have too many side effects, whatever. So this has been looked at before, and this is a large study, 705,000 patients from the VA health system. And they looked at people that took them apart and took them together. And there wasn't any difference in the side effect profile. None. And they looked at all the kind of outcomes, cardiovascular, neurologic, immune-mediated events, and there was no increase in any of the events when they were given together. I think these studies now are really big. So they actually looked at the medical records of 2.5 million adults in the VA system, and then it was 705,000 of those who received the flu and COVID vaccine at the same time. So that the study is millions of people, and it's just, I think it's refreshing just to know that in a vulnerable population, elderly veterans for the most part, or people with underlying diseases, that it was very safe.
Very safe, and that's very good news. Some
Mhm.
not so good news is that the US measles situation continues to grow and spiral. Can you tell us about it?
Yeah, we are up to 2,134 confirmed cases so far in 2026. So we are on target to beat 2025, the whole 2025 by the end of summer. We will get to that number, and 2025 was a record-breaking year. So remember, that about 6% of people that get measles require hospitalization. They can get very sick and, people can die. We still have the 3 deaths that have been reported, no more deaths. The root driver of these epidemics is pockets of unvaccinated people, so vulnerable people. So the overall coverage for measles vaccination has fallen from 95.2% to 92.5. So it's just a 3-point drop, but this is such a contagious thing that has a big impact. And that's the average coverage. So there's many places, matter of fact, where all these outbreaks are happening, where the coverage has dropped in some cases to 50%. So those communities are going to be really, really at risk. And that's what's happening now. We're playing whack-a-mole. It goes down in South Carolina, then it's up in Utah, and then it's in Virginia. It's wherever the vaccination rate drops on, the lower it drops, the higher is the risk that somebody's going to get exposed to measles, and it's going to take off there. So this is just never going to stop unless the overall coverage goes back up.
Mhm. And now turning our eyes globally, can you give us an update on the Ebola outbreak we're seeing in the Democratic Republic of Congo?
Not too good. It's 1,300 confirmed cases, almost 400 deaths. 609 patients currently are hospitalized. So we got a little late start on this particular epidemic because we had the wrong test at the beginning, and this is a slightly different strain. It spread in the Democratic Republic of the Congo to a fourth province. That's not good. There was an additional case reported in Uganda, I think, in the last day or two. Um, so, what's the good news is the U.S. federal authorities have recently asked Congress for $1.4 billion in emergency funding for the response. So we're sort of getting back to what we used to do when these things came out. The European Union also kicking in, and they're going to be studying, or they are studying, the impact of a monoclonal antibody test, excuse me, monoclonal antibody treatment, and remdesivir, a drug that's also used for COVID, by the way, and see if those are having any effects. So those studies will be going on as the epidemic proceeds.
Mhm. As always, we will keep an eye on those case numbers and continue to report on the progress of that outbreak. But shifting our focus to the US, there's been a lot of tick talk this summer about tick viruses. We hear a lot about Lyme, but one we don't hear a lot about that is on the rise is the Powassan virus. Can you tell us about it?
Yeah, Powassan, we don't hear about it too much because there's not too much of it. So this is a virus that's spread by the same tick that spreads Lyme disease. Everybody knows Lyme disease. There were only 7 reported cases in 2015. And in 2025, that number jumped up to 76. So an increased tenfold, but still, it's only just 76 cases last year. Mostly in the same places where Lyme disease is. New Jersey, New Hampshire have reported the cases. The difference is that with Lyme disease, the tick has to be on you for a number of hours, 16 to 24 hours before it can spread the disease. Powassan is much more contagious. It only has to be on you for as little as 15 minutes. So you get a tick bite, tick on you, you don't have long to get rid of that thing. And the other big difference with Powassan is that it has a fatality rate of 15%. And of the survivors, a lot of them have neurologic complications. It's really a nasty, nasty disease. Fortunately, pretty rare, but I mean, if these numbers keep going up, it will maybe won't be so rare.
Something to have on our radar. Our final story today is a new study looking at the risk of autism and ADHD linked to Tylenol use during pregnancy. Can you break it down for us?
This was a weird history of looking at acetaminophen, which is Tylenol, is one of the trade names for it. But acetaminophen has been around for a long time. So it's a relatively mild and weak analgesic, pain pill. It doesn't work very good, but it does some. And, there's many reasons why you don't want to give kids aspirin and, many reasons why people don't want to take non-steroidal anti-inflammatory agents like ibuprofen. So anyhow, it is an alternative. So uh, it has been supposedly linked to autism, but the data was really, really bad. So people were really worried about this, or some people were worried about it. Anyhow, it caused a few studies to be done to see whether this was real or not. That's okay. So this is published in JAMA Internal Medicine. This is a respectable journal. The study looked at 124,000 children who were being evaluated for autism and 97 for ADHD. From 2001 to 2023. They found no association between prenatal acetaminophen exposure, in other words, the pregnant women taking Tylenol or acetaminophen, with either of those conditions. So that's great news. And that is actually not new. It's new that this study is new, but there's a growing body from international evidence from Japan, Norway, Sweden, Thailand, Taiwan, and Denmark, which have centralized medical systems that have also looked at this issue and found no association at all with in these pregnant women who took acetaminophen. So, in the development of autism in the offspring. So, I think this closes the study, the fear that is a risk. And if you have to take acetaminophen and you're pregnant, you can. And it's going to have nothing to do with autism or ADHD.
Mhm. And of course, I am not a doctor, but I do understand that the risk of having a fever or some illness that would cause a pregnant woman to take acetaminophen can cause far greater risk to the fetus than taking the acetaminophen
Right.
itself.
Yeah. Yes.
Well, on that note, I'd like to thank you, Dr. Murphy, for closing that case for us and for breaking down all that is important this week in public health.
All right. Well, have a great weekend. Happy July 4th.
Thank you. Yes, everyone, please enjoy this long holiday weekend if you're here in the US. We thank you for watching this week and hope to see you next week. Of course, any questions or comments are welcome down below. Have a great weekend.